Selamat petang, cikgu ucapkan kepada ahli-ahli PBSM kerana sudi hadir pada mesyuarat am yang ke-11. Jadi kita akan mulakan dengan mesyuarat am yang ke-11 pada petang ini. Okey, sebelum kita memula, kita akan mulakan mesyuarat ini dengan nyanyian lagu PBSM.
Bulan sabit merah di Malaysia, giat berjasa untuk negara, tidak kira kaum dan agama, waktu aman atau bahaya. Di mana jua adanya sengsara, di sana ada kita. Di darat dan laut kita bersedia, walaupun diancam bahaya. Bulan sabit merah gerakkan sedunia, membantu semua yang menderita. Badan sukarela berkhidmat dengan tabah dan bersemangat.
Terusnya, marilah kami menjemput Saudara Alan Tang untuk melaporkan kehadiran bagi hari ini. Saudara Alan Tang, dipersilakan.
Selamat 40 ahli yang menghadiri ke mesyuarat ini.
Terima kasih Saudara Alan. Seterusnya, marilah kami menjemput Saudara Chen Xiong Wei untuk melaporkan pengesahan minit mesyuarat yang lepas. Saudara Chen Xiong Wei, dipersilakan.
Sekarang merupakan pengesahan minit mesyuarat yang lepas. Tarikh 21 Mei 2021 Jumaat. Masa 1.10 hingga 1.45. Aktiviti mesyuarat am ke-10. Tempat Google Meet. Guru yang hadir cukup telefon. Bilangan kehadiran 65 orang. Ini mesyuarat 1.0. Kata alu-aluan pengisi unit 1. Pengurusi unit Overlink Gosen telah mengalu-alukan kedatangan semua ahli ke mesyuarat ini. 2.0 lagu BSM. AK dan ahli telah menyanyikan lagu BSM dengan penuh semangat dan serius. 3.1 kehadiran. Seramai 65 ahli telah menghadiri ke mesyuarat ini. 4.0 Setiausaha Unit 1 Chen Xiong Wei telah membentangkan minit mesyuarat yang lepas. Pencadang ialah saudara Nicholas Lee bin Zi dan penyokong ialah saudara Jesse He Lian Chen. 5.0 lain-lain. 5.1 Kurs kurikulum sekolah 4 dari 21 Mei 3 PM hingga 24 Mei 3 PM. Ahli digalakkan menjawab soalan sebaik sahaja ia dibuka pada 21 Mei 3 PM. NYOG National Youth Online Gathering akan diadakan pada 22 Mei 2021. 1. Dari 2 PM hingga 4 PM di Zoom. Ahli harus masuk semasa 1 setengah kerana terdapat banyak peserta. 5.0 khusus perawatan rumah. Dianjurkan oleh PBSM daerah sibuk ditunda ke 5 Jun 2021 dari 2 PM hingga 4 PM. 5.4 Pertandingan kawal kaki individu PBSM daerah sibuk. Tarikh tutup ialah 25 Jun 2021 dengan 50 hukum kawal dan harus memakai baju uniform lengkap atau t-shirt PBSM. hubungi Cikgu Ting untuk maklumat lanjut. Masyarakat ini telah ditangguhkan pada 1.40 PM. Depan saya perlu seorang pencatatan. Terima kasih saudara Hian Chen. Saya perlu seorang penyokong. Terima kasih saudara Nicholas Lee.
Terima kasih saudara Tim Chong Wei, dan seterusnya marilah kami menjemput Cikgu Tim untuk memberitahu anda aktiviti yang akan dilaksanakan. Cikgu Tim, dipersilakan.
Terima kasih saudara Howard Lin dan saudara Chen Chong Wei atas mini mesyuarat yang telah dilaporkan tadi. Cikgu ucapkan terima kasih kepada semua sekali lagi ya kerana kehadiran kita yang masih kekal agak tinggi lah bagi cikgu lah saya rasa. Okay, so kita balik kepada National Youth Gathering yang telah lepas, minggu lepas telah kita sertai ya. Dan cikgu minta kalau ada ahli-ahli yang telah menyertai National Youth Online Gathering ini, sila hantar CJ anda kepada cikgu melalui Telegram secepat mungkin supaya cikgu boleh rekodkan kehadiran dan juga pelibatan anda di dalam SMS sekolah yang berkenaan dengan National Youth Online Gathering. Kemudian untuk khusus rawatan di rumah, cikgu harap kamu orang buat catatan pada dia telah ditunda pada 5 hari bulan Jun pukul 2 hingga pukul 4 petang. Tapi cikgu tidak pasti lagi sebab ini yang diberitahu sebelum 2 minggu yang lepas. So kita masih menunggu sama ada dia ada ditunda atau tidak sebab saya rasa masa ini kurang sesuai lah sebab ini masih lagi di masa cuti sekolah. Saya rasa mungkin ramai yang tidak dapat mengikuti sebab mungkin saya akan berbincang lagi dengan pihak PBSM lah. Tengok macam mana mereka nak aturkan sebab kalau letak pada 5 hari bulan Jun, masa ini masih cuti sekolah. Takut nanti tak ramai yang akan menyertai khusus ini. Okey, kemudian untuk pertandingan kawat kaki individu PBSM daerah Sibu, sekali lagi cikgu ingatkan kalau ada mana-mana sesiapa yang ingin menyertai sila bagi tahu cikgu lah. Sediakan video pada masa cuti panjang ini ya. So untuk this coming 2 weeks untuk yang 2 minggu yang akan datang iaitu pada hari Jumaat depan dan hari Jumaat yang akan datang, kita tak ada perjumpaan tidak ada perjumpaan. So cikgu harap tapi cikgu masih akan buat pengumuman maklumkan kepada anda tentang National Youth Gathering yang akan diadakan pada 12 Kita akan sebab kalau kita lihat National Youth Gathering yang seterusnya adalah pada 12 Jun. So cikgu harap anda catch out lah sebab dia masih ada lagi masa cuti iaitu hari Sabtu sebelum kita buka sekolah. So ikutilah maklumat yang terkini lah dalam kumpulan Telegram yang ada yang telah anda sertai. Ini saja daripada cikgu. Dan seterusnya kita akan sambunglah untuk yang khusus pertolongan cemas. Khusus pertolongan cemas pada petang ini adalah berkenaan dengan sakit secara tiba-tiba, sudden illnesses. Sudden illnesses itu penyakit-penyakit yang boleh datang secara tiba-tiba. So we go through very quickly lah. So this one is about the sudden illness that we might facing in our daily life. So for example, this one the unexplained changes in the responsiveness. So it's a level of unresponsiveness indicates how well the brain is functioning. So maybe it's because of sometimes our blood sugar glucose is too low or too high. Mungkin kerana kita punya glucose dalam darah kita terlalu rendah atau terlalu cepat boleh menyebabkan respon kita menjadi kurang. So ada kala sometimes it's because of the seizure. 旁边有华语字 sometimes it's because of the seizure or because of stroke or because of shock. Shock bukan terkejut tapi shock di sini adalah disebabkan oleh darah kita tidak dapat menghantar darah yang mencukupi ke anggota-anggota ke seluruh organ penting dan menyebabkan badan kita mengalami keadaan yang dipanggil sebagai shock atau renjatan. Okay, so the level of unresponsiveness indicate how well. So this one like temperature. Sometimes our body temperature is too high or too low. Or too high, it may be because of the heat stroke, or because of the high. If it is too low, it is because of the hypothermia. Or oxygen, maybe we cannot. Our body cannot cannot receive is not able to receive the adequate oxygen or enough oxygen, tidak mendapat oksigen mencukupi ya. Poisoning because of the drug or alcohol overdose or carbon monoxide poisoning. Then pressure on the brain. Pressure on the brain maybe because of the brain injury or the head injury. So let's look at the first one. Is a heart attack. So I think most nowadays we found that the cases the death cases caused by the heart attacks is increasing. So this one is occur when the blood flow in the heart is reduced. Because of our blood vessel is being become narrow, is become narrow than the normal size. Also occur when the blood flow to the heart is reduced or cut off. So it's because of the arterial cirrhosis or ischemia or heart attack or the myocardial infarction, MI. Ini adalah beberapa sebab mengapa kita berlakunya kejutan sakit jantung. So this is the difference between the heart attack and the cardiac arrest. Heart attack is one or more of the artery delivering the blood to the heart becomes blocked. Our blood vessel blocks. So it's causing the blood cannot send to our heart. Then cardiac arrest is either the heart stop beating or the heart's lower chamber suddenly develop a rapid irregular rhythms, causing the ventricle to quiver rather than contract. Dia disebabkan oleh kita punya jantung tiba-tiba berhenti berdenyut. So recognizing a heart attack, so you can use the chest. You can see someone is having the chest discomfort, or he is not feeling very well. Especially he can feel the chest chest pain. Then discomfort in other area of the body. Then shortness of the breath and other signs like breaking out in the cold sweat. 冒冷汗nausea 恶心很想要呕吐then the lightheadedness dia rasa pening-pening kepala. So care for the heart attack, so you must call the 911 and monitor his breathing and also help the victim to sit down into a comfortable position. For the victim who has a heart attack, the best position for him to rest is not to lie him up down, but let him sit by lying on the wall. Lean on the wall macam ini untuk kita biarkan dia duduk dengan sandar ke dinding. Then have the victim to take the aspirin if he has the drugs, if he has the medicine with him. Then find out if the victim is using the nitroglycerin. This is the medicine that he is using. Then angina. This one is we call it as like sakit kepala, bukan sakit kepala, like kita sakit jantung, bukan sakit jantung tapi sakit tiba-tiba di bahagian jantung. So chest pain called the angina pectoris can be result from the coronary heart disease. So this one it's occur when the coronary artery become narrow and cannot carry the sufficient blood to meet the demands. Inilah yang saya katakan tadi kita punya salur darah menjadi lebih sempit menyebabkan darah tidak dapat sampai ke jantung. So it will so during the physical exertion or during the excitement, when he is very excitement, when he emotional upset, eating of the heavy meal or extreme hot or cold temperature exposure and the cigarette smoking. Then recognizing the this one, the angina, so the chest pain described as the crushing or squeezing. Dia rasa sakit dada macam kena dihimpit. It will spread to the jaw. It will spread to the jaw, arm, and the mid back. And it will last from 3 to 10 minutes. And then it can be relieved by using the nitroglycerin. Ini adalah ubat yang mereka guna lah. So pain associated with the shortness of breath. Dia rasa sesak nafas, nausea and sweating, and also anxiety. Anxiety dia rasa macam cepat marah, bingung. Then care for the angina. So you can give the drugs that affect the blood supply, like coronary vasodilators and the nitroglycerin. Have the victim to sit down and let the victim use the prescribed nitroglycerin. But we are not the doctor, so what we can do is we can ask whether he has any medicine that he is taking or not. If he has, then we let him to take the medicine, and then you call the 999. In our Malaysia, we are using 999. If discomfort and does not improve within 5 minutes. So then we come to the heat illness. 我们身体太热，有时候是身体不是很热，是太冷So the heat related illness. Heat illness is a spectrum of the disorder due to the environmental exposure to heat. So it include the minor conditions such as the heat cramps. So kalau badan terlalu panas, dia boleh menyebabkan kita mengalami heat cramp, iaitu kejang kerana kekejangan kerana kepanasan, atau kita panggil sebagai saya sudah lupa apa nama dia. Okay, it's okay. Heat syncope and the heat exhaustion, as well as the more severe condition known as a heat stroke. Heat stroke yang lebih teruk lah sebab dia badan tidak dapat melepaskan kepanasan melalui berpeluh. Okay, so heat rush or pricky heat. This one yang kamu nampak lah kalau badan dia, kulit dia panas, dia akan keluar bintik-bintik merah. So pricky heat is sometimes called the sweat rush, or by its diagnostic name, which is miliaria rubra. So the children tend to get it more than the adults because their sweat glands are still developing. Biasanya berlaku kepada kanak-kanak. So pricky heat is uncomfortable and itchy. So sign and symptoms. So you can see the red cluster or the pimple or the red blister usually on the neck, upper chest, groin, under breast, and also in the elbow creases. So extensive area of the skin that do not sweat on heat exposure, but present the goose flesh appearance that subside with the cold environment. So kita biarkan dia lah di dalam keadaan yang sejuk lah supaya dia dapat mengurangkan rasa katal lah pada bahagian kulitnya. So ini adalah so this is a care for the heat rush. So rest at the cooler or less humid work environmental. So keep rush area dry. So kita letakkan tempat yang kita biarkan tempat yang kena rush itu biar dia kering. Powder can be applied to increase the comfort. Do not use ointment or the cream as they may impair the cooling. So warm, moist skin can make the rush become worse. So heat cramps. Heat cramps 我们讲太热了，所以抽筋So heat cramp, a type of the heat illness, are the muscle spasms that result from the loss of large amount of salt and water through exercise. So heat cramps are associated with the cramping in the abdomen, arm, and calves. So this can be caused by the inadequate consumption of the fluid or electrolytes. Dia disebabkan oleh kekurangan air di dalam badan, menyebabkan badan kita mengalami kekejangan. So heat cramps, so the sign and the symptom, the muscle will cramp, and then you feel pain and it spasms in the abdomen, arm, or legs. Normally it's in the abdomen and the legs. Care for the heat cramps. So drink fluid every 15 to 20 minutes and eat a snack or the sport drinks. Or call it sport drink is all the isotonic drinks. Avoid the salt tablets. So get the medical help if the casualty has the heart problems. Is on a low sodium diet, or if the cramp do not settle, if the cramp keep on continue within the 1 hour. So after 1 hour it still come, the cramp still coming, so you have to send him to the hospital. Then the hip syncops of the fainting. So fainting is a mild form of the heat illness that often result from the physical exertion when it is hot. So it occurs when your body is an effort to cool itself because the blood vessel to dilate to such an extent that blood flow to the brain is reduced. Ini adalah disebabkan oleh darah yang sepatutnya dihantar ke otak itu berkurang kerana kita berdiri ataupun darah tidak dapat sampai ke otak dengan secara normal. Then the sign and the symptom, fainting or dizziness or light headedness after standing or suddenly raising from the sitting or lying position. Untuk mereka yang biasanya ada anemia sedikit, bila mereka berdiri mereka rasa mereka berdiri ataupun terus dari keadaan pandai mereka terus berdiri mungkin mereka rasa pening-pening. So care for the heat syncope or the fainting, sit or lie down in a cool place. When beginning to feel faint or dizzy, then slowly drink water or clear fluid, clear juice. Let him drink some water. But if he is really unconscious or fainted, don't give any drinks because you may make him become choked by the water. Then the heat exhaustion. Heat exhaustion is a condition whose the symptom may include the heavy sweating and a rapid pulse, a result of the body overheating. So it is one of the 3 heat-related syndrome, with the heat cramp being the mildest and the heat stroke being the most severe. So ini adalah tahap yang kedua lah. Biasanya tahap pertama ialah heat cramp. Kemudian tahap kedua dia lebih serius lagi adalah heat exhaustion. Tapi yang paling teruk adalah heat stroke. Because heat stroke itu dia sendiri badan tidak dapat mengeluarkan peluh. But heat exhaustion is okay. Heat exhaustion is dia masih boleh mengeluarkan peluh. Masih boleh keluarkan peluh. Okay, heat exhaustion. Also, the sign and symptom is a headache, and then nausea, dizziness or weakness, irritability, thirst, heavy and sweating. Then the elevated body temperature. So the body temperature is rising up. Then the decreased urine output. So the urine is less less to the normal condition. So care for the heat exhaustion, call for the medical help or take casualty to a health facility for evaluation and treatment. So stay with the casualty until help arrive and then remove the casualty from the hot area and give the liquid to drink and remove the unnecessary clothing including the shoes and the socks. Cool the casualty with the water or the cold compress and ice bath. I don't encourage the ice bath, but you can use the tepid sponging or the fan, and then encourage the frequent drink. Let him drink more water cold water Then heat stroke. Heat stroke is more serious compared to the heat exhaustion. Heat stroke also known as the sunstroke. It's a type of the severe heat illness that result in a body temperature greater than 40 degrees Celsius and confusion. So this one, sometimes when you have a heat stroke, don't go out because if you go out and then you want to enter the supermarket or anywhere, then they found that your temperature is more than 37.5. They will ask you to go back. So sign and the symptom, confusion and outer mental stature. So slur speech, percakapan yang tidak jelas, loss of consciousness. So dry, he has a hot, dry skin or profuse sweating. Profuse sweating not necessary, but for the heat stroke, normally the person having the heat stroke they cannot sweat. Seizure, this one is seizure, very high body temperature, fatal if the treatment is delayed. It can cause death if the treatment is being delayed. So care for the heat stroke, call for the emergency care immediately. So move the casualty to a cooler area and then remove all the clothing. And then cold casualty with the we let the casualty cool down using the water or the cold compress, or I not encourage you to use the ice bath, but we can use the tepid sponging. Tepid sponging means you use you use a towel, and then you then you try to use the tap water put into the tap water, and then you try to put it on the body of the casualty. So, and then let him under the fence, then circulate the air around the casualty to speed the cooling, and then you can place the cold or wet clothes on his head, but I'm not encourage you to use ice, don't use ice, or the head, neck, or armpit and groin, and then stay with the casualty until the emergency medical service arrive. Don't use ice. For the case when you have the heat stroke and heat exhaustion, we use the tepid we will use the tepid sponging tap water to cool down the body temperature. Then we look at the stroke. This one is caused by the brain attack. The occur when there is a sudden interruption of the blood flow to the brain. So occur when artery in the brain rupture or become blocked. It become blocked. So effect are permanent. Please bear in mind the effect is permanent. So once it's blocked, so you cannot say okay, then after that he will become okay already, but you found that he may lost some memory or he become slower than the normal condition. Then this one is the ischemic stroke. Ischemic stroke is occur when the blood vessel become narrow or clogged with a plug. Then the hemorrhage, this one is more dangerous than the ischemic stroke. Occur when the blood vessel rupture in or near the brain. Okay, this one. So recognizing the stroke, weakness, numbness, or paralysis of the face or one side of the body, blur or decreased vision. So his vision, he see the thing looks blur, everything. Problem of speaking or understanding, dizziness or loss of balance, and then sudden or severe or unexplained headache, and then deviation of the eyes from pearl. They have a different size of the pupils. So when you suspect a stroke, so you try to look at his face. So you found that if he has a facial drop, and you try to look at his arm, or ask him to raise out his arm. So you found that he cannot raise out his arm. Then speech. So you found that ask the victim to talk something. So you found that the victim is not able to talk properly. Also his speech is slur. And then time. Also it's time for us to call. If you found that these three conditions coming, also it's time for us to call for the ambulance or the EMS to come. So this is what you can see. So you have, if you see he has a face drop or the arm drift, so he cannot move up, lift up his arm, or you found that he cannot speak normally. So you have to call ambulance, call 999. So call 999 immediately, check the time at which the first sign appear, monitor his breathing. If if he become unresponsive and no breathing, so place in the recovery. If he is unconscious, means that unresponsive, but he has breathing, so you have to put it in the recovery position. If he is responsive, means that he is conscious, and you can put it in the comfortable position with the head elevated, tinggikan kepala sedikit, elevated. Do not give the victim anything to eat or drink. Reassure and keep the victim warm. Yeah, so asthma. So I don't know how many of you have seen your friends or your family member having this type of problem. I found them out now. There are more and more children they're having the problem of asthma. Maybe it's because of the our air is not really clean enough. So the chronic lungs disease that inflame and narrow the airway. This is what happened. So the airway. This is the narrow airway. So causes the recurring period of sneezing and the chest tightness. and then shortness of breath and coughing. So once he has asthma, you will see he will try to breathe very very deep, but it's short, but he still cannot. So you can see the sign and symptom. So common asthma triggers. So these are the common asthma triggers, like the environmental. Normally they will have the problem when they are under the cold air, or the house with the dust mits, and then the cockroach animals like the furs and so on. Indoor irritants, like the wood burning stove, and then the outdoor air pollution, and then the indoor or outdoor moths and fungi, tobacco smoke, smoking, and then the pollen like from the flower and the tree or grasses, drug and chemicals like aspirin, beta, this one the beta blocker medicine, fruit or the drug preservative. And then the seafood, and some of them they cannot eat the seafood. Then occupational exposure to the chemicals and the household cleaning agents and perfume. Some people they cannot smell the perfume. Once they smell the perfume, then they start to sneezing. Okay. Then the conditional of the event, like the gastro. This one I'm not sure what is this, but maybe you can check through the internet. Allergic. Okay, this one. Yeah. Panic attack, and then the menstruation and the pregnancy. Sometimes maybe because of some of the conditions, so he become asthma. So he or she become asthma. Viral, the respiratory infection, and then the emotional stress or excitement, and then the exercise. So these are the conditions that may cause the asthma triggers. So recognizing an asthma attack, so symptoms that can range from mild to severe. So excessive coughing, so he will try. So the coughing is become more and more serious. Sneezing, and then the chest tightness, shortness of breath, sitting in the tripod position. Then the inability to speak in the complete sentences, and the nostril flaring. So care for an asthma attack. So place the victim in the comfortable position. Ask about the medication, long-term control, and then that he must have the quick relief medicine. So if the sign begin, victim can take 2 puffs of the quick relief medicine. But this one is only for their own medication. You cannot take one person asthma this one the asthma medicine and then give to another person. Only for the person who belongs to that one. You 不可以拿别人的给他用，因为他们的量不一样。Okay, then the medicine is not helping if breathing is hard and fast. If the nose open wide during the breathing and victim cannot walk or talk well, so you need to call 999 or take the victim to the emergency department immediately. So then we go to the hyperventilation. This one we have seen this one during the marathon run. So you found that after they come back, maybe they will have the hyperventilation, ventilation. So we'll see the victim have the fast and deep breathing. Commonly during the emotional stress, or also caused by the untreated diabetes, or severe shock, or certain poison, or brain swelling, or high altitude. But I see this case when we went to the first aid duty for the marathon run. So you will see he has a shortness of breath and then fast breathing. His breathing is very fast, tingling on the numbness on the hand. Yes, he has the numbness on his hand. He say his hand start to become numbness from the fingers until his arm and around the mouth, dizzying or the lightness or the lightness. This one. Then so care for the hyperventilation. So we come and reassure the victims, take the victim to a quiet place or ask a bystander to leave. And then we encourage the person to breathe slowly using the abdominal muscle. Then he can inhale through the nose and then hold the full inhalation for 1 or 2 seconds. Then after that, exhale slowly through the pulse leaf. But sometimes they don't want to listen to what we want them to do. So what we can do is you can ask him to another way is you can ask him to breathe using this one using the plastic bag. Then he can see the plastic bag become expand, and then after that release and so on. Ask him to breathe using the plastic bag. So chronic obstructive pulmonary disease. So this is the both term apply to the emphysema or the chronic bronchitis. Then related heart disease. So most common factor is the cigarette smoking. And then the most commonly diagnosed is those who are older than 60 years old. So you can see how to recognize the COPD. So you will see the person is sneezing and then coughing, shortness of breath, and artificially supply oxygen. So he need the oxygen supply. So care for the COPD. So assist the victim to take the medication if he has his own medicine. Place in a comfortable sitting position and encourage the victim to cough up the secretion. Then encourage the victim to drink some fluids, and for acute the breathing distress, obtain the immediate medical assistance. Then fainting is almost the same like what we have just now. Is a heat cramp. This one under the heat. So sudden brief loss of the responsiveness, not associated with the heat, not associated with the head injury So it is because of lack of oxygen that enter that go to our brain. Also called the syncope or psychogenic shock. Most fainting episodes are associated with the decreased blood flow, causing the deficient oxygen or glucose in the brain. So decrease the blood flow can be caused by a slow heart rate, or the heart rhythm disturbance, or dehydration, or the heat exhaustion, anemia, or the bleeding. So the decreased glucose can be caused by the diabetes or medication used to treat the diabetes and the infection. Then recognize the fainting. Also, you see the person become dizziness, and then weakness, very weak, seeing spots. You can see some star when he see everything. He see the star in then the visual blurring. So he see everything like very blur, nausea, and then pale skin and sweating. So care for the fainting. If above to faint, so prevent the person from falling down. So help the person to lie down. This one ask the person to lie down, and then loosen the tight clothing at the neck and the waist. And also stay with the victim until he or she recover. And if possible, we can rest his, or we can elevate his leg elevate his leg a bit, so that at least around 6 inches in order to let the blood go back to the brain. So if fainting has occurred, monitor his breathing and loosen the tight clothing and the belt. Check for the injury. Have the victim to sit or lie down better. Give the cold or the if he already wet out, so only that you can give the cold or the sweetened liquid to drink. But if he is still unconscious, don't give any things in through his mouth. Help the victim regain an upright posture, and fresh air or the cold wet cloth for the face, usually after he recover. It will help him to recover. Let ask the ask the people to give way and then give some air fresh air to the victims. Then seek medical care if the victim has had repeated episode of the unresponsiveness. If he keep on become fainted, so ask him to see doctor. Does not regain the responsiveness, or you try to ask him to wake up, but seems that more than 30 minutes he still cannot wake up. So you have to call for ambulance, call for help from the medical side. Loss of responsiveness or faint for no apparent reason. So seizure is a symptom of epilepsy. So epilepsy is the underlying tendency of the brain to produce sudden bursts of the electrical energy that disrupt other brain function. So severe medical condition can be lead to the seizure also. So lack of oxygen, heat stroke, poisoning, electrical shock, hypoglycemia, high fever in children, or the brain injury, tumor or the stroke, alcohol withdrawal, drug abuse, or overdose. So recognizing the convulsive seizure. So typically lasts for 1 or 2 minutes only. And then he will see the person suddenly fall down to the ground or on the floor. And then he will start to stiffen his arm and the leg muscle, followed by the jerky movement. Or he was shaking with the arching of the back. So forming, you will see some his mouth, the saliva come out from his mouth like the forming at the mouth, and then the gritting of the teeth. So he will grin on his teeth, and then bruised gray color of the face and lips. His lips may turn to the blue color, bruised color, or gray color. Eyes roll upwards. Mata dia terjuling ke atas, loss of bladder or the bowel control. Mungkin dia terkencing kalau dia keadaan serius lah. Mungkin dia terkencing sebab dia memang tidak sedar apa yang sedang berlaku. Then last only for a few seconds. So for the non-convulsive seizure, it will last for only a few seconds, and then you see a staring, mata dia macam ada bintang-bintang, confused and inattentive. Dia tidak dapat menumpukan perhatian. Frequent eye blinking, dia asyik memejam mata dia tu, involuntary movement. And then the prolonged seizure called the status epilepticus, so require the immediate medical care if he keep on having the prolonged seizures. This one can lead to the brain damage or the fracture or even the severe dehydration. So first aid for the convulsive seizure: do not restrain or hold the person. Clear the area of anything that may hurt him, or sharp, anything that is sharp, try to remove, and then loosen the tie and then the scarf or anything around the neck and also the belt. Place something flat or soft under his head in order to prevent his head from injury. Then turn him or her onto one side. The purpose is to open his airway when you turn him to one side. So do not try to force the mouth to open. So stay with the person until the seizure ends naturally. Ask if there is anyone who should be called to help him or her to get home. If he has friend, let his friend to go home together with him, because we don't want he on the way when he go back, so suddenly the seizure come back again. Then look for a medical ID. Maybe he has the history of the seizure before. Then first aid for the non-convulsive seizure. So watch the person carefully, explain to others what is happening, guide the person away from the danger, and then stay with the victim until he or she has fully recovered. Then when to call the 911, when to call 999. If the seizure lasts more than 5 minutes. Normally seizure will be finished, will be end around 5 minutes only, not more than 5 minutes. The second seizure, if you found that after first seizure finish already, then the second seizure come back again very soon, so means something wrong with maybe he have something wrong with his body already. Maybe he has a head injury or something. Alertness does not return after shaking. Then a seizure happen in the water. This one very dangerous. If he is swimming in the pool, in a pond or in the water. So if the seizure happen in the water, you have to call 999. So if the victim is injured, or if he has a diabetes or pregnant, if he has no medical identification tag is found, or the victim has never had a seizure, so we have maybe you can advise him to go and see the doctor if this is the first time he is having the seizure. And then the diabetes, the emergency. So insulin is a hormone produced by the pancreas that assists the body in using the emergency from food. So diabetes develop when the insulin is either ineffective or lacking. So it's diabetes come because our body cannot produce insulin according to the needs of our body. So type of diabetes, so we have type 1 diabetes is commonly diagnosed in the childhood and require the external insulin. Then we have the type 2 diabetes. When you have excess the body weight or the sedentary lifestyle risk factor. This one especially for those who are big obese. Then gestational diabetes occur in some pregnancy. This one for the women when they have the pregnancy. So you found that they suddenly have the diabetes. This one is gestational diabetes. Usually treat with diet. So they have to control through the diet. So low body blood sugar or hypoglycemia, too much insulin, too little or delayed food intake, or he has excess exercise, alcohol taking, or any combination of this factor. Then recognizing the low blood sugar, so you see he will have the sudden onset and then the struggling, then poor coordination, and then the clumsiness, and then the anger, bad temper, pale face color, confusion, disorientation, sudden hunger, excessive sweating, trembling, shakiness, and then the seizure, and then the eventual unconsciousness. So this one, if we have the low blood sugars, so for the low blood sugars, the rule of 15. So the diabetes should check the blood glucose or eat 15 grams of sugar. If the condition does not improve in 15 minutes, so give 15 more grams sugars. For the case hypoglycemia means he has a low blood glucose. If still no improvement, seek for the medical care. If the victim become unresponsive, call 999 immediately. Seek medical care following a diabetes episode. And then glucagon, this one is when you have a higher blood glucose this one, so they will put into the so glucagon is an injection medication that quickly raises out the blood glucose given by the physician prescription. What's the opposite of the insulin? Many people vomit after receiving it. So this one is the injection to increase out our blood glucose. So recognizing the high blood sugars, this one is hyperglycemia. You see the gradual onset, the drowsiness, extreme thirst, he feel very thirsty. Very frequent urination, flushed skin, and then vomiting, fruity breath odor, then heavy breathing, and also eventually become unconsciousness. So for the high blood sugar, give a responsive victim a beverage or the food containing sugar. If there is no improvement within 15 minutes, so seek the medical care immediately. And then the abdominal complaints, or people with the gastrointestinal problems complain about the abdominal pains that is itching and then sharp or dull or nausea or vomiting, and then he may have the diarrhea or constipation. So the abdomen is the area between the diaphragm and the groin. So it's neither feasible nor useful for the first aider to distinguish among the many causes of the abdominal pains. So first aid usually will be similar regardless of the causes. So how to recognize when did the pain start, where is it located, is the pain constant, or does it come or go, does the belching or passing gas relieve the pain, or does the victim feel nauseated, or does he or she have a good appetite? This one is how we recognize. So is there any diarrhea or vomiting? Is the victim having a fever? Does anyone near the victim have the similar symptom? Is there a chance of pregnancy, or is the abdomen rigid to the touch? So care for the abdominal pains, give the victim clear fluid, give the victim this one antacid. But if possible, we are not the doctor, we don't give anything, but you can give him some water to drink. So place a hot water bottle against the victim's abdomen or soak in the water bath. This one is giving his hot compressor. Be prepared for vomiting and keep the victim in a comfortable position. Seek medical care if pain is constant and severe, if the victim is unable to drink the water, or if the victim is or might be pregnant, or if the abdomen is rigid or swollen. More pain occur after you press your fingers on the victim's abdomen and suddenly release them. So this is what we can do lah. If there is bloody or the bloody, so seek medical lah. If you can see the bloods come out, or the victim has a fever, or the pain begin around the belly button, and later move to the lower right part of the abdomen. Okay, so I will stop here and pass to our AJK to continue. Cikgu biarkan AJK untuk teruskan petang ini.
So now is our gaming session. So for the gaming session later, Wong Chunja will be our MC. So later he will tell you all how to play this game. Chunja, please.
Okay, sekarang kami main game. Game ini namanya Who is the Spy? dalam bahasa Cina谁是卧底lah. Okay. Jadi game ini macam ni lah. Kami anda semua perlu guess lah. Perlu guess siapa dalam 7 orang AJK itu. Ada seorang dalam 7 orang AJK, saya bagi mereka perkataan yang tidak sama dengan orang lain. 6 orang perkataan yang sama, tapi seorang itu yang perkataan tidak sama. Nanti mereka akan masing-masing describe lah apa perkataan mereka yang mereka dapat. Okay, kamu orang yang hampir 50 orang ini guess lah. Dalam 7 orang ini siapa punya perkataan yang tidak sama. Okay, 谁是卧底都会玩猜我们lah. Okay, mula dari Alan.
Okay, bahan ini merupakan satu bahan yang anda akan gunakan dia hampir setiap hari. Ya.
Okay, bahan yang akan digunakan oleh kami setiap hari. Okay, yang kedua ialah siapa? Okay, kedua orang Clemelau.
Bahan ini amat mudah dijumpa di kedai-kedai alat tulis.
Okay, amat mudah dijumpa di kedai-kedai tulis. Okay, orang ketiga Howard.
White in color. White in color.
White in color. Okay, berwarna putih. Okay. Keempat Sikang.
Barang tersebut boleh dilipat.
Boleh dilipat. Okay, boleh dilipat. Okay, kelima Charles.
Boleh dalam warna itu berbagai jenis.
Boleh dalam berbagai warna lah berbagai jenis warna. Okay, Xiong Wei.
Bahan itu sangat nipis.
Sangat nipis. Okay. Patrick.
Bahan ini selalu guna semasa kamu tulis.
Semasa tulis. Okay, boleh mula guess sudah? Boleh mula guess? Saya akan ambil banyak. Kamu tulis nama dia lah. Nama AJK itu. Yang kamu rasa dia suspicious, you know. Saya akan pilih nama yang paling banyak ditulis itu. Macam tak ada orang main ni. 哈？什么哈？tak faham apa game ini tak？
死亡过和平的那个，你们都懂，我们都听不懂呢。
那我用华语讲，你们听得懂吗？来，你们猜我们不是我们之间互相猜。那我用华语再讲一次了哈，这个是谁是卧底啦？不过不是我们之间猜，是你们来猜我们。我们这边有7个 AJK， 有6个 AJK 是一样的字，有1个 AJK 字是不一样的。然后就像刚才那样，他们一个一个都已经大概形容了他们的字是什么。就猜了你觉得哪一个人的字是不一样的？就一个人而已，就写他的名字，然后我会选最多人写那个名字的人。OK， 还有吗？还有吗？26 saya akan pick siapa yang paling dipilih. 26. Kalau mau cakap lagi, coba cakap. Okay, lagi, ada lagi. Okay, surah 26. Saya tengok Okay. Banyak yang pilih Charles. Okay. Banyak yang pilih Charles. Okay, Charles out. Okay. Second round, go. Start dari Alan.
Dia boleh dijadikan berbagai bahan, ya bahan.
Berbagai bentuk你要讲。
Ya, berbagai bentuk boleh juga.
OK， 可以变成任何形状啊，当然把它杀青啊。OK， 接下去。下一个是谁？我忘记了。OK，Clement。
Senang di gitar semula。
Senang di gitar semula。OK， 很容易被循环利用。接下去是Howard。
Can found in every house.
Can be found in every house. OK。Next. Sikang.
Barang tersebut dihasil oleh kayu.
OK， diperbuat daripada kayu。OK， 用木头做的了哈，用木头做的。然后胸围。
Dia ada banyak jenis bentuk.
Banyak jenis bentuk. Banyak jenis bentuk。OK 啦，banyak jenis bentuk 有很多种形状，跟刚才 Alan 讲的很像。OK，Patrick。
bahan ini bukan satu warna saja。
上一轮讲过了，换一个。武将啊，考试啊，OK， Semua orang sudah habis. Okay. 来 mula guess lah. Okay, 猜了。Okay, ada lagi? Saya akan pilih orang itu keluar cepatlah, sebab masa hampir habis. Okay, ada lagi? Saya tunggu dua suggestion lagi. Okay, nampaknya banyak orang pilih Dan Sikang. Okay, Dan Sikang out. Okay, lagi third round, go. Ellen.
Bahan ini merupakan satu produk. Bukan wujud secara semula jadi.
bukan我住的食材什么来着地 OK 人造的不是自然就有的 OK 下一个 Clement
Sentiasa diguna oleh cikgu dan boleh dicari di pejabat guru.
OK sentiasa diguna oleh cikgu dan boleh dicari di pejabat OK 老师经常用的哈 OK 下一个是谁了下一个侯二
has many colors
讲过了
can be found in supermarket
can be found in supermarket OK can be found can be found in supermarket next 雄伟
dia boleh digunakan untuk membungkus hadiah.
membungkus hadiah 可以用来包礼物了哈，用来包礼物。OK Patrick。
dia boleh digunakan sebagai bahan untuk buat dalam perhiasan seperti kertas kapal terbang yang dibuat daripada kertas.
OK sangat obvious sudah哦可以用来做装饰物了哈 OK 来 boleh mula guess cepat guess cepat habiskan cepat boleh bersurai lah ha sudah sangat close sudah OK ada orang jaga Patrick全部也 JK 了快点啊ada member ada ahli biasa selain AJK Okay ada 4 orang jaga Patrick 3 orang jaga Clement Lau Okay Patrick out lah ho Okay 4th round lagi cepat Ellen
banyak digunakan 再讲多点 di seluruh dunia
banyak digunakan di seluruh dunia okay sangat umum okay Clement
harganya agak murah
okay 接下来是什么接下来是谁接下来是侯二
ada telinga.
Hah?
yang telinga itu dalam bracket telinga.
Cannot hear， 说大声一点。
是有耳朵的东西，那个耳朵是开关引号那个耳朵。
有耳朵 ，OK， 那个耳朵是开关引号的。Ada telinga, tapi telinga dalam inverted comma. Okay, lagi siapa lagi? Siapa lagi ya? Xiong Wei
dia selalu digunakan oleh cikgu.
Selalu digunakan oleh cikgu 已经讲过了。
oleh pengetua.
Sama.
Oleh ibu bapa.
Oleh ibu bapa. Okay, boleh melangkis. Cepatlah. Ada 2 orang jaga Xiong Wei. Okay. Kita jaga Howard. Okay, setakat ni 2 orang jaga Xiong Wei, 2 orang jaga Howard. Okay, orang ketiga jaga Howard. Ada lagi? Kalau tiada lagi, saya pilih Howard loh. Okay, Howard out. Lagi last round. Alan.
Sangat ringan.
Sangat ringan. Okay, sangat ringan. Next, Clement.
Boleh jadi alat pembunuh orang lah kalau kamu sangat tak tahu bagaimana cakap.
Okay, kalau boleh dijadikan alat pembunuh orang kalau digunakan dengan berkemahiran lah. Kalau kamu berkemahiran, kalau kamu pandai guna lah. Okay, Xiong Wei.
Boleh dijadikan permainan.
Permainan. Okay, boleh dijadikan. 可以拿来当玩具了哈。Okay, go. Cepat, last round. Kalau round ini masih tidak dapat orang yang tidak sama itu, anda semua kalah lah. Xiong Wei, okay, panggil orang jaga Xiong Wei, panggil Xiong Wei. Okay, panggil Xiong Wei okay. Nampaknya orang yang tak sama itu pandai main Okay. Okay lah, Xiong Wei out. Okay, orang yang tak sama itu cepat jaga diri lah. Okay, Clement menang. Okay, Clement yang tak sama itu. 6 orang dapat perkataan kertas. Okay, tapi Clement dapat manila card. Tahu apa manila card? Itu kertas yang lebih keras dan ada banyak warna itu. Biasanya lebih besar itu. Okay lah, game ini tamat di sini. Okay, Howard.
Jadi terima kasih kepada atas semua atas kehadiran untuk hari ini. Jadi saya harap semua orang dapat hadir ke acara yang selepas ini ataupun aktiviti yang selepas ini. Saya rasa ini daripada saya. Ting ada apa tambahan?
Okay, di sini ada link sila isi kehadiran link sebelum kamu keluar Sebab setiap minggu memang ada pelajar yang tidak isi dan terus sudah keluar. Sila isi jangan menyusahkan saudara Alan Tan dan Chen Xiong Wei kita. Dia kena cari siapa yang ada datang tapi tidak tulis. Okay, so please fill in the form for the attendance today. So in the chat there, so please before key in before you leave, so that Chen Xiong Wei and Alan Tan can keep your record, the attendance record. Thank you and see you after our school holiday. So we will meet again at on 18th of. We'll meet again on the 18th of June, 18th of June.